Good afternoon, Sanai. We're having a little bit of a technical issue, so we're trying to get our presenter to be able to get into the presentation. She's having some difficulties, so we're working on that now. So if you don't mind holding on and standing by.
Can you guys hear me now?
We can hear you.
Yeah.
Yay.
Much better.
Good. All right, good. Can you guys see me?
We can see you.
Hooray.
Yay. Okay. Awesome. Sorry about that. I don't know what happened.
That's okay.
Well, we were having our own little difficulties, so I have no idea. Sometimes.
All right, so I'll go ahead and get started. Good morning, everyone, and happy Valentine's Day. Today we have a special guest, Janelle Trujillo, registered dental hygienist, who joins us today to talk about dental hygiene for children to observe National Children's Dental Health Month.
Are you able to upload your slideshow, Janelle?
Yes. So let me get that going. 1 second here.
Turn our music down some so it's not too distracting.
Are you guys able to see my slideshow?
I'll have to add it in.
Okay.
I think the computer's acting weird. It's doing whatever it wants to do. Okay, add to stream. There it is.
Awesome. You guys ready for me?
You should be able to control it from your side.
Okay, awesome. All right, so yes, I am Janelle Trujillo. I am a registered dental hygienist, and I firstly want to apologize about my voice. It's a little off this morning, but I'm actually going to be talking to you guys about kids' oral health, being that it's February, it's National Children's Dental Health Month. And so I'm just going to be giving some tips, just some facts and ways to help your children. So this first slide is just kind of an overall why kids' oral health is so important. So one of the biggest things is that cavities are one of the most common chronic diseases in children right now. And what's crazy is it's actually preventable. And so I'm just going to be going over brushing techniques, some good preventable measures like sealants, fluoride varnish, healthy dieting, things like that. And so just going into that second bullet, a healthy diet and limited snacking is crucial to children's oral health and preventing tooth decay or cavities. And then brushing, flossing, fluoride, sealants are all other ways as well. So risk factors, definitely consuming, a lot of sugary drinks, juices, sodas, things like that. You want to limit those. Water, milk are all good alternatives for those things. And then just snacking frequently. So making sure, breakfast, lunch, and dinner are, good, healthy, nutritious meals will really help with that in the risk factors of developing tooth, cavities. High risk in families. So, if you know that you have a history of, being more prone to cavities, just making sure you're doing these things to help your children and brushing correctly, preventative measures, like I stated, which we'll go over as well. orthodontics. And the reason why I said orthodontics or what's been shown is that it's hard to clean with, braces on. Most kids that throughout this, their adolescent time have braces. And so making sure we're teaching them to brush and floss just as normally as they would without the braces. And so I'll kind of go over that as well. And then kids with special needs. They need more help, especially when they have special needs, helping them brush, supervising, making sure they're brushing 2 times a day, and flossing, things like that. So, and so I kind of broke this up into babies and then sort of, older children. And so, parents for babies, the biggest thing is, after they've, whether it's breastfeeding or, formula, you want to still wipe their gums with a clean cloth. So in the morning and then, before bedtime or whenever they, really actually after any feeding is great. You just take a clean cloth, wipe away their gums, and it just kind of wipes away any bacteria to help keep their oral health, completely healthy. This next one is the same thing for babies. When teeth start to come in, definitely want to start brushing twice a day. Just with the key is soft bristled toothbrush. And as you could tell in that last picture, there is devices for parents where it's almost like a little silicone you put on your finger and you just kind of help brush on that one tooth and still wiping away the gums. And just with plain water is completely fine for that. The biggest thing as well is once the child turns 1, getting them an appointment with their dentist. And the reason why is just to make sure developmentally everything's going good. Things like fluoride varnish they can start applying to the first teeth that are coming in. And so you want to make sure that once they turn 1 that you're making that appointment with the dentist. Another thing is just talking to your whether it's dentist or doctor about placing placing fluoride varnish. All it is just a hair fluoridated content that's placed on your children's teeth. And I know, for example, I have 2 boys. Once my child turned 1 at his actual pediatric office for his checkup, they asked me, do you want to put fluoride varnish on his teeth? And I said, absolutely. And really, it's just help preserving the teeth, protecting them from cavities. And so, always say yes to those kinds of things. Those are great preventative measures when those first teeth start to begin to develop. And then as far as for children, once they start getting past the 2-year-old range, brushing their teeth twice a day with a fluoridated toothpaste. It can be any type of brand as long as it's got some sort of fluoride content in it. You're going to want to make sure it's a pea-size amount. So I know a lot of parents or even us as adults, we tend to put, a whole strip of toothpaste on our toothbrush. But really, all you need is a pea-size amount, especially for the little children. Making sure you're having the routine of doing it in the morning and before bedtime. It's super crucial before bedtime. Excuse me. Because what ends up happening is they have, food and drinks that they're consuming throughout the day. And then if they're not brushing at night, that stuff is sort of sitting on their teeth all throughout the night, making them more prone to cavities, making them more prone to having gum issues. And so, if there's a more crucial time, it's definitely nighttime. But, making it a routine, morning and night. And then, of course, children require supervision. They might tell you, I brushed my teeth, Mom, and you don't know because you weren't, there to kind of supervise them. So it's super crucial for us as parents to just make sure that we're making sure they brush their teeth. And examples are my boys. I tell them, go brush your teeth. I will watch them, they brush, and then I kind of go over everything and brush for them. And so that's just super crucial in their oral health. This next one is more so just depending on where you live. Drinking tap water is actually not a bad thing because it contains some sort of fluoride content in it. I kind of gave this website. You can actually go on the CDC and look up your certain area to see how much fluoride is contained in the water. There's also things like if you decide not to do tap water, getting fluoride supplements, for your child, talking to the doctor about that, the dentist, things like the fluoride varnish, just to help prevent those things if you're not getting fluoride in that aspect. And then parents for children, dental sealants is probably one of the most amazing things as far as preventative. So I provided this picture, and basically it shows tooth without a sealant. So once those first molars start popping up for children, they get these deep grooves in their teeth. And so, food and particles and bacteria like to hang out in those deep grooves of the teeth. And so what we do as dental professionals is we will place the sealant. It's not a filling or anything. We're not drilling the tooth, but we're basically placing this flowable material into those deep grooves using a light to cure it, and then it lasts forever. And it's basically preventing anything from getting in those deep grooves. So sealants, if you're ever, told, hey, you're eligible to get these sealants, I say go for it. Get the children their sealants because it's just, like I said, another good preventative method. And so with that, like I said, tips and tricks, you always want to make sure they're brushing correctly. And I'm actually going to show, I have a little model here. And so this is my little model. This is a kid's toothbrush. And so the biggest thing about brushing is you're brushing in, especially for kids, in circular motions and up towards what we call the gum line. And so what that allows is for us to, I don't know if you guys can see, but for us to make sure we're stimulating the gums, but also getting rid of that plaque when you're doing that circular motion. And so, up towards the gums, brushing. Once you become behind, you'll be doing the same thing. And as you approach this weird arch in our mouth, our children's mouth, you'll kind of bring it at an angle and you'll brush the same way in circular motions. And you'll do that on the top and bottom. And so that'll help prevent, tooth decay, things like that, and getting those areas where you can't normally get. Like I said, pea-size amount of fluoride toothpaste is ideal. And so, you don't need a long strip of toothpaste on here, just that pea-size amount, very little, as us as adults can do the same as well. But you don't need very much. The biggest thing is, spitting it out and no swallowing. And so it's kind of, when they're one and two range, it's hard to teach them that. And so the biggest thing is kind of this tell, show, do method. And so when they're at that age of, being able to watch and mimic everything you're doing or everything that brother and sister's doing, have them go in with you for your morning routine. Show them, hey, I'm brushing my teeth, mommy's spitting out. You don't swallow, spit out any of the excess, and then just rinse. And so I'll give you an example. My 2-year-old, he, for the longest time, didn't understand spitting out. And so he started watching me more. And then we started, introducing the fluoride toothpaste very little. And eventually he actually got the hang of, spitting out his toothpaste and then getting a cup and just swishing it around and spitting it. And so a lot of the times it's just a tell, show, do, showing them what to do and then letting them try it. And so just, another tip and trick for that. And then conclusion, I sort of liked this little banner here. I thought it was awesome because it kind of puts everything all together. But one thing I didn't mention is the biggest thing is not sharing utensils with your child, or, I know we as parents sometimes want to clean the pacifier with our mouth if, whatever reason. So the biggest thing with that is, most people don't realize they transfer bacteria. And so, for example, if you have somebody who has high bacterial load in their mouth from gingivitis, whatever, and then you go and share your spoon with your child, that same bacteria is transmitting into their mouth. And so it makes them more prone to having issues in the future. And so just making sure if you're going to do that, wash the spoon and give them a spoon, or, pacifier, same thing. Eating healthy, like I said, getting them on a good diet as far as not the sugar causing foods like chips and brownies and all those things, in moderation. And so things like nuts and cheese are great snacks for children. And then just like I said, making sure they're getting healthy, nutritious meals during breakfast, lunch, and dinner will help with that from the frequent snacking. And then, like I said, no later than 1, getting them in for their first dental visit. And then sealants, if they've got those first molars, go ahead and get them sealed. There's no harm in doing that. It'll just keep, that bacteria from getting in those grooves. And then brushing, 2 minutes, two times a day. 2 minutes might seem like a long time, but actually, if you break it up into 30-second increments, so for example, I'll show you with my son, he actually will brush himself on one or what we call quadrants on the upper left. Then I will go through and do it and make sure I have my timer going for the 30 seconds, and then we knock out one area, have him spit, and then I go to the next area, and it ends up amounting to the 2 minutes, if that makes sense. So you just have to kind of find what works out for your child and what they like. Sometimes you can kind of put on a cartoon or something while you're maybe flossing, and that'll help as well. Flossing, definitely introduce flossing once they start getting those teeth. And you can do that by having them watch you floss first, and then going through and showing them that, hey, let me floss your teeth. And so those are just, tips on how to help out with that. Let me go ahead and exit out of here. And I don't know if you guys could see the video of me showing, but I can show real quick. So if you couldn't, just again, recap, here's my model. And with the kids, you're just brushing in a circular motion up towards the gum line, all the way around. Flossing. One thing you want to remember with flossing is you're making a C. And so if you tell them, you're going to make a C around your tooth, you're going on one side of the tooth, then the other side of the tooth, and then all the way around. Like I said, I kind of distract my 2-year-old by having him just lay down, and I put a little cartoon on and I start flossing. And usually by the time I'm done, he's like, oh, you were done, Mom? So just some tips and tricks on that. And so I don't know if anybody has any questions or anything like that.
Yeah, we'd like to open it up for questions if anyone has any. I really appreciate you giving us this presentation today. I know dental health is super important for kiddos, and they're so little and tiny. Sometimes it's hard to figure out how to get in there.
Absolutely. Yeah. And so whatever, like I said, works for you as a parent, just find little ways to help out with that.
And I wanted to also introduce you to my colleague, LaDon Yazzie. She's our tribal
public health educator.
Yeah.
So
Nice to meet you, LaDon.
My question is in regards to the type of toothbrush that you recommend for maybe in general, just everyone across the board. What do you recommend?
So really, they all kind of do the same thing. The biggest thing you want to look for in a toothbrush is that it's soft, bristled. You don't want to do hard bristled for any medium bristled. So as long as it's a soft toothbrush, whether it's the brand Colgate or Oral-B, those are ideal. And so those are what I recommend all the way across the board, is any type of soft bristled toothbrush.
Okay.
I also have a question. When a kiddo has a painful tooth, is there something that they can get over the counter that's helpful for that?
Yes, absolutely. So obviously Orajel is a really good one. I used it a lot for my teething babies. I know that now they have little tablets, dissolvable little tablets. The moment it hits the child's tongue, it kind of dissolves. And so I know that really helps with teething babies as well. And so I would say out of, those two, like any one of those two products is a great thing. Orajel, you're just kind of placing in the area where it's causing specific tooth pain, but that tablet will really help kind of overall, especially if they're teething or something like that. But I would say if it's progressing to, extreme pain, then, definitely call the dental professional and get in for an appointment for that.
Thank you so much. If anyone has any questions, if not, I think we'll wrap it up. That was really great. Especially about baby oral health. I never knew how that worked, just because their teeth are coming in, and I know that milk, like breast milk and formula, have a lot of sugars and things that can create bacteria. So
Yeah, absolutely. And I think most people don't. So it's good for them to know that whenever I see an expecting mother, for sure.
So we do have a question also from Raylene, who is our special diabetes program director. And she wanted to know when you first bring a child to the dentist, I think you said it was a year, but also how frequently after that should you bring your children to the dentist?
Yeah, that's a great question. Typically, we say every 6 months, just like it would be for an adult. Especially if there's no issues. The dentist is looking in their mouth. Typically, what they do is a knee-to-knee exam, and so they'll have the baby laying down. Doctor will be knee-to-knee with mom, and they're taking a look at the baby's teeth or the 1-year-old's teeth. And if there's no concerns, then they'll say every 6 months. If there's a concern of some sort that doctor wants to follow up on, it might be a little bit more frequent, but typically 6 months is the standard. So good question.
Excellent. All right. To see. Okay. Well, I really appreciate you doing this today, and I think you're all set. Do you have any questions, Ladon? You're good. Okay.
No, I'm good.
All right. Well, folks, thank you for joining us for this excellent presentation on children's dental health. And if you have any further questions, maybe you missed the stream, you can email me at rjolin@cdcfoundation.org. And I will get your questions to Janelle later.
Thank you guys so much for having me on.
Thanks again for joining us.
Have a good day.